Welcome, everyone. We'll give you a few minutes to get into the room here and we'll get started. Thank you so much for joining us. All right, so people are still kind of loading in. We'll give you a second to get into the room before we introduce the session. So excited to see you all here. Thanks for joining again. I know we just saw you last week, so seeming a little all too familiar. You might be having a little deja vu. All right, so welcome LBDA family to session number 19 in our 2024 webinar series, Empowerment Through Education. I'm Julia Wood, the Director of Professional and Community Education here at the Lewy Body Dementia Association. And I hope at this point, we've gone through a lot of content this year that you're starting to feel like you have some empowerment, hopefully feeling more like you have Lewy rather than it having you. So today's webinar, just like last week's, is in recognition of National Family Caregivers Month. Celebrated every November, National Family Caregivers Month is a time to recognize and honor family caregivers across the country. It offers an opportunity to raise awareness of caregiving issues, educate communities, and increase support for caregivers. And we could not have chosen a better guest for today's presentation. In honor of the work of caregivers, we will be joined by Dr. Allison Appelbaum. After her presentation, two additional LBD care partners, Judith Kobaleski and Craig Denham, will join Dr. Appelbaum to talk about their experiences. And then the panel will answer some of your questions that we welcome you to submit throughout the presentation using that Q&A button. So let's go ahead and start talking through the session here, shall we? So this is what I just mentioned. Our session today is strategies for modern meaningful caregiving. Our agenda today, Dr. Appelbaum will present first. After my brief intro here, we'll have a panel discussion. And then, as I mentioned, we'll take some questions from the audience. So with that, I want to tell you a little bit more about LBDA. So we are a nonprofit dedicated to optimizing the quality of life for those affected by Lewy body dementia. We provide comprehensive education for the community and professionals in events like this, deliver compassionate support. You met my colleague last week, Brandy Hackett from our support services team, and we strive to advance awareness and research. And you'll be hearing more from our research team in upcoming weeks. So then a few housekeeping items here for you. You can select the show captions at the bottom of your Zoom tool or bottom of your screen on your Zoom toolbar. Now, if you're on a tablet, sometimes that toolbar may be up at the top, but if you hover over it, you should have a little toolbar pop up and you can find that closed captioning. You'll notice that there's also a resources icon on that same toolbar that has links and downloadable resources to accompany today's session. As I mentioned before, you're welcome to submit your questions throughout the presentation using that Q&A icon. And remember, last week we talked about, we try to take the questions as close to the topic as we can. So if you have questions that we don't get to today that you really need answered, I'll give the information for our support line soon, and we encourage you to reach out to them. And then following Dr. Appelbaum's presentation and the brief panel discussion, we'll take some of those questions from the audience. All right, so then exciting news to streamline your access. We now have a ribbon on our homepage that Rose will pop in the chat that can direct you to our webinars that are upcoming so you can get registered, and also direct you to our LBDA TV site, which you see here. And this is where you'll be able to watch the recording of today's presentation in about a week, and you can watch all of the recordings from our past sessions over the last couple of years. Okay, so this is being recorded. We always get that question. And if you registered, you'll get that link to view the recording as well as some complimentary resources in about 1 week. But you can always go to our LBDA TV channel and find that. And then lastly, when you leave the session today, a brief survey is going to appear asking about your feedback on today's presentation and also asking about your feedback about the series over the year. And we hope that you'll take some time to answer that survey and help us out as we're planning for 2025. All right. Now, a little bit here, as I mentioned, this is that support line number 1-800-539-9767, or you can email support@lbda.org. So if you find that your questions don't get answered for whatever reason today, we encourage you to reach out to our support services team to get more information. Okay, and with that, I'm going to stop sharing. We're going to learn more about who's with us today. So Rose is going to launch a poll so we can see who is joining us today. And then once we've got that poll up, then I'll share the results with everyone. All right, so multiple choice here. Are you a person with LBD or LBD symptoms, a care partner, former care partner, healthcare provider, family or friend of someone with LBD, or researcher and scientist? Oh, having some sound issues. Let's see. Looks like my microphone is good, but I'm not sure what's going on with that. Let's see. Try this one. Is that any better, Rose? Doing a little tech check here. You can chat me. I'm seeing it. I apologize, you guys, for the sound issues. All right. Huh. All attendees are saying no sound. That's interesting. Huh. So is everyone having no sound? All saying no sound. That's really strange. Let's try a different one here. What about now? Can you hear me now? Maybe give us some comments in the chat. Now we're getting some thumbs up. There we go. Thank you for the reaction. Okay, excellent. All right, so it must have been, that's weird. Hopefully my microphone's sounding okay. This was the one that was a little problematic in the tech chat. All right, so back to that poll. Now that you can hear me today, so you'll notice we've got almost 80% here of our audience are care partners. Thank you so much for joining us. We've got about 8% of you are people with Lewy, and we talked last week about how that can be helpful to really understand the experience of your care partner. And then also we have healthcare providers in the audience. So important for healthcare providers to understand how to work with you as a team. And that doesn't mean your care partner has to be your spouse. It could be a friend, it could be a family member, but making sure that they're working with whoever supports you. We've got about 13% are family or friends of someone with Lewy. And then we got about 4% are researchers and scientists, which makes a lot of sense. There's a lot of research going on into this currently for Lewy. All right, so I'm going to stop sharing that poll. And then we have another poll that Rose is going to launch here, now that you can hear me. Oh, they had to select stream and allow audio and video. Interesting. I don't think we've ever had that before. Still sound issues. Okay. I'm going to go back to my other microphone if that was the issue then. Give me a thumbs up if you can still hear me. Looks like no thumbs up, so I'll go back to the other microphone. Oh, no. Okay, cool. All right, we'll stay with that one. Okay, she thinks it's a setting, not my microphone. Thank you all. It takes a village to run these webinars, I tell you. All right. So now this next care partner poll. So this is specifically for care partners out there in the audience, which is almost 80% of you. So tell us which of these best describes how you identify. So are you a spouse, an adult child, a family member, friend, a professional caregiver, or maybe we didn't hit your category and you fall into an other? All right, so I'm going to end the poll here and share the results. So you can see here, we've got the majority of spousal care partners. Not sure if you guys remember last week when I presented that research that we found in our survey anyway, that most of our care partners were female spouses and adult daughters in our survey we did. We've got about 15% of you though that are adult children, about 5% a family member, and then we've got 2% professional caregivers and about 2% in that other category. So thank you so much. That really, really helps. Excellent. And so after our presenter will do our next poll before we get started with our panel. So with that, I would really like to bring on our presenter today, Dr. Allison Appelbaum. And she is a caregiving scientist, writer, researcher, speaker, and advocate. She is a professor of geriatrics and palliative medicine and the director of the Center for Caregiving at the Mount Sinai Health System. She was previously the founding director of the Caregivers Clinic at Memorial Sloan Kettering Cancer Center, the first program of its kind in the United States to provide comprehensive psychosocial care to family members and friends of patients who are in the caregiving role. Dr. Appelbaum's program of research focuses on the development and dissemination of supportive services for family caregivers. She has published over 100 articles, reviews, and book chapters on these topics, and is the editor of the textbook Cancer Caregivers. Dr. Appelbaum has received competitive funding for her research, including awards from the National Cancer Institute, the National Institute of Nursing Research, and the American Cancer Society. She is also the author of the recently published narrative nonfiction book, Stand By Me, a guide to navigating modern meaningful caregiving after that trial by fire that she got as a caregiver. So thank you so much for joining us, Dr. Appelbaum.
Thank you so much for having me, Julian. Can you hear me okay?
It sounds a little muffled, but I can hear you.
Oh, that's strange. Okay. Nothing's changed since before, but let me go ahead and share my slides and make sure that you all can see those. All right. Can you see these, Julia?
Yes, that looks good.
Okay, perfect. All right. Well, thank you so much, Julia, for the introduction. And thank you to all of you for joining today. It really, I cannot say, there's actually, as my dad would say, there are no words actually to say how meaningful it is for me to be presenting to you all, given that my journey was one with a care partner with Lewy body dementia. So it's particularly meaningful that I get to speak to this community. I'm so thrilled to see that so many care partners are in the audience, patients in the audience, healthcare professionals in the audience, and just grateful that you've given yourself an hour or so of your day to join us and to honor caregivers as we are in the midst of National Family Caregivers Month. As Julia mentioned, I am a caregiving scientist. I've been studying family caregivers and providing care to family caregivers for 15 years. I'm currently on faculty at the Mount Sinai School of Medicine, a professor of geriatrics and palliative medicine, but this is a role I stepped into just about 2 months ago. And for the past 15 years, I've been on faculty at Memorial Sloan Kettering Cancer Center, where I was the founding director of the Caregivers Clinic, which was the first targeted psychosocial care program for family caregivers in any cancer center in the country. And so I want to share with you today some of the most important lessons that I have learned, both as a result of my experience as a caregiving scientist, as well as my experience as a family caregiver. So we know that there are at least 53 million caregivers in the United States today. You all are in great company. To borrow the words of former First Lady Rosalind Carter, who was an incredible advocate for caregivers and addressing the mental health needs of caregivers, there are only 4 kinds of people in this world: those who were caregivers, those who are caregivers, those who will be caregivers, and those who will need caregivers. This is a role that touches all of us. It is a role that we enter and exit repeatedly throughout our lives, and one that deeply changes who we are and the trajectory for our life moving forward. Now, my colleagues and I have recently been noticing that the literature on parenting, the parenting space, has somewhat co-opted, if you will, the language of caregiving to refer to parents taking care of children who are perfectly healthy. This picture was taken in November of 1981, the year and the day that, November 4th to be specific, the day that I was born and the day that my dad became my parent and, if you will, my parental caregiver. So those of us who do this work professionally strongly believe that when we refer to caregivers, we are referring to individuals who are caring for those living with chronic or life-limiting illnesses or disabilities or mental health challenges, that it's a much different role than parenting a child who is perfectly healthy. This picture was taken 34 years later on my birthday over a decade ago, as I was my dad's primary caregiver. What I'll say, though, is what these two caregiving roles and what these two pictures have in common is love. And that is what is at the heart of what it means to be a caregiver. As caregivers, we give of ourselves physically and emotionally and spiritually and existentially and financially. And we do so too often without training, education, or support. And what we give of ourselves is love, is care. Now, before I speak any further about caregiving, which I will do, I want to take just a few minutes and tell you about my dad, Stan Appelbaum. My dad was an incredibly prolific musician. He was a composer and orchestrator and arranger and conductor, and he worked with many of the great artists of the 50s and 60s, including Benny King, Danielle Sedaka, Connie Francis, and Brian Hyland, just to name a few out of many, many, many artists. Now, my guess is that everyone in this Zoom room has already heard a piece by Stan Appelbaum, and that all of you have heard this specific string line before. So my dad had his hand in every element of Benny King's Stand By Me. But of course, I'm biased when I say this, but what turned Stand By Me into from a piece of music to a piece of art was the string section in the middle. This was my dad's composition, something he wrote on a whim one evening when he was playing around with how rich and full he could make just a few stringed instruments sound. And of course, little did he know that it was a string line that would become beloved by generations to come. Now, my dad was an incredibly masterful musician, but much more importantly to me, he was an incredibly talented father. He modeled for me emotional vulnerability. He was exquisitely supportive. And around him, I felt safe, loved, and expansive. All right, I'm going to turn back to caregiving now. When I joined the Department of Psychiatry and Behavioral Sciences at Memorial Sloan Kettering Cancer Center in 2010, I was doing my fellowship in psycho-oncology. I am a clinical psychologist by training, and the field of psycho-oncology combines cancer care and mental health. And what was so striking to me that year, as I sat with patients primarily with advanced life-limiting cancers, was their narratives were not so much focused on their own mortality, but on their parents and partners and children and siblings and friends. Individuals left in the waiting rooms and left at home. Individuals who they identified as the linchpin of their care and who would be most deeply impacted by their eventual death. Now, I realized back then, this was 2010, long before the COVID-19 pandemic, that cancer care specifically, but healthcare more broadly, was very reliant on family caregivers to shoulder tremendous responsibilities without actually providing them with training to do so. And despite the fact that the scientific literature had already very well documented distress in caregivers, at that time, there were no support services for caregivers in any cancer center in our country. And so a year later, I founded the Caregivers Clinic at Sloan Kettering, whose mission is to assure that no caregiver experiencing significant distress as a result of their critical role goes unidentified and deprived of necessary psychosocial services. The clinic provides support to caregivers of patients with all sites and stages of cancer, from diagnosis through bereavement. Now, what my patients were unaware of is the same year that I founded the clinic, I stepped into the caregiving role for my father. You may have guessed that he had me a little bit later in life. He was about 60 years old when I came into the picture. And he lived until his late 80s with only minor medical problems, and then had a series of hospitalizations, and during one of them had developed pretty significant delirium, which is a confused or altered mental state. Many of you are likely familiar with this. It's very scary for caregivers to witness. And he was unfortunately given a medication he should not have been given to treat the delirium. And that medication put him into a coma. There was one silver lining of this coma-like state, and that is that it actually gave his team of doctors the hint that he might have Lewy body disease. And a subsequent PET scan confirmed that diagnosis. And I don't need to tell any of you in this room what Lewy body disease is, but what I want to emphasize is how it's presented in my father, because it can present very differently in different individuals. So for my dad, He would have sudden drops in blood pressure and temperature to near hypothermia levels, and he would hallucinate. And he'd hallucinate anywhere from a few minutes to a few hours. Occasionally, the hallucinations would last an entire day, and one time an entire week. We had no idea how long they were going to last, and I personally experienced each one of them as a mini death. Now, when my dad was in the coma and during each period of subsequent hallucination, I learned the first lesson that I want to share with all of you. And that is that you are responsible for preserving the identity of your care partner, for telling their story or helping them to tell their story. I learned very quickly that without me by my dad's side to serve as his eyes, ears, and voice, that there was no way for any members of his passing medical teams to have any idea who Stan Appelbaum was and what mattered to him. Without me there, assumptions were made about who my dad was based on the date of birth on his wristband, which was 1922, and the fact that typically when I brought him to the ER and he had a urinary tract infection, he was hallucinating and couldn't engage meaningfully. I felt on the defensive for years, trying to convince members of his passing medical teams that what they saw in front of them was not my dad's permanent lived reality. This was a man, by the way, who wanted to live to 103. That was his goal. He continued to write music from his hospital bed. At age 92, he chose to learn Tagalog, the language of his home health aides. This was a man who wanted to continue to grow and to learn and to be creative. But had I not been there to convey this part of who he was, he would have never received care that would have allowed him to continue to live that life. Now, in the book that I recently published, and now you all know why the title is the title, it's called Stand By Me, a guide to navigating modern meaningful caregiving, a dual meaning with that title. In the first chapter, I provide you with a comprehensive list of information that you should have on hand every time you bring a care partner to the hospital. I'm not going to go through this with you right now, but what I want to emphasize is that it is just as important for you to know all of this information, to know your care partner's health history, the medications they're taking, the events that led to the hospitalization, as it is for you to understand what their goals of care are and what their goals of life are. For you to understand what their values are and what they hope to achieve in the future, so that you can help them to get care that is in line with those values. Had I not done so, had I not stood by my father during this period initially and every subsequent hospitalization thereafter, and there were many, he would have never survived this coma, and he would have never gone on to enjoy nearly 6 additional years of life, where he was able to enjoy many beautiful moments sitting out in the sunshine, drinking his favorite drink. Now, very early on in my caregiving journey, I learned the second lesson, which I'm going to share with you all. And I realized that I am speaking to an audience of experts. You all primarily are care partners, so you already know these things. For those who are not, maybe I'll shed a little light. For those who are, maybe this is just a validating reminder for all that you're doing. Hopefully there's some takeaways regardless. But you all know this. You all are critical members of the healthcare team. You know, as caregivers, we don't wear white coats. We don't carry pagers, but we are healthcare team members nonetheless. We are often the missing link between patients and healthcare professionals. We are often the bedrock of communication that is happening. And as healthcare professionals, as caregivers, your responsibilities are vast. I want to just shed light on 3 domains of responsibilities that often come as a surprise to caregivers who come to our caregivers clinic. And these include medical and nursing tasks, case management, and healthcare communication. So in terms of medical and nursing tasks, I have been so overwhelmed over the past 15 years in recognizing the significant increase in enormity and complexity of medical tasks with which my caregiver patients are asked to assume. You know, we as caregivers these days, we are asked to perform tasks that were once only performed by trained healthcare professionals. And too often we are doing so without actual training. Now, currently in the country, oops, we have, my slides. Well, my slide messed up, you saw it. Currently in this country, we have what's called the CARE Act. the Caregiver Advise, Record, Enable Act. The CARE Act is passed in 45 states and territories, and it has these 3 provisions. It requires hospitals to document the name and contact information of caregivers in the records of patients when a patient is admitted, requires hospitals to let that caregiver know when a patient's going to be transferred or discharged. And very importantly, it requires hospitals to provide that caregiver with training and education so that they actually know how to take care of a care partner at home. The reality is, and I know you all know this, CARE Act is not consistently implemented. It was passed in New York State before my dad died, and I never received any training. So I have a few suggestions for you. Before you leave the hospital, I encourage you to ask a nurse or another member of the healthcare team to demonstrate for you all the things that you're going to need to do when you get home. And then I want you to perform all of those tasks back to that nurse to ensure that you feel confident and competent to do so. Then many patients are prescribed visits from a visiting nurse after being discharged from the hospital. I want you to do the same thing. I want you to look at every visiting nurse visit, both as an opportunity for your care partner to be evaluated and for you to brush up on your skills. Now, in terms of case management, case managers are by definition paid employees of healthcare systems who coordinate care. But we, of course, as family caregivers, we do this free of charge. And on that note, I want to acknowledge that in 2023, the annual economic value of caregiving in the US was estimated at $600 billion. $600 billion. Despite the fact that 1/4 of caregivers report high financial strain and 1/5 end up going into poverty because of caregiving. So there's a huge disconnect between the value of our efforts as family caregivers and the financial cost of caregiving to ourselves. As caregivers, your case management responsibilities can be vast. I have a picture of somebody on the phone here because often case management for me meant spending a lot of time on the phone, often on hold for hours. It includes coordinating care and communication between multiple healthcare professionals, navigating pre-authorizations and insurance, navigating making the home safe, implementing home care, et cetera. I will say just very briefly for me, the most overwhelming aspect of my case management responsibilities was getting my dad onto Medicaid to implement a home health care plan for him that was safe and sufficient. The journey was an incredibly complicated one, so much so that I've devoted an entire chapter of my book to the Medicaid system and home health care to hopefully demystify the process for those of you who are potentially thinking about doing so. And I'll just say right now, for anybody who is considering getting onto Medicaid, I encourage you to start the process yesterday because the wait times can be quite lengthy. So I do hope that you'll find that chapter helpful. A third domain of responsibility is healthcare communication. And some of you might be thinking, well, that's not really a responsibility. But from my perspective, this is really the bedrock of what we do as family caregivers. We are engaging in healthcare communication with patients, with our care partners, and with healthcare professionals all of the time. And I know that these conversations can be very difficult. So throughout my book, I provided you with many, many concrete tips and tools, communication tips and tools to help you open conversations. And I want to share 2 of these tips and tools with you today. Many caregivers say to me that they want to ask the doctor something, but they think that their care partner doesn't want to know the answer, and so they ultimately don't ask, which then prevents families from getting information that might be important. If you are in a situation like this, I encourage you to have what we would call a consent conversation. A consent conversation allows you and your care partner to get on the same page about what is going to be talked about with the doctor. It's something that you're going to do, the conversation, you're going to have it long in advance of going to the doctor. And it might sound something like this. Dad, I would really like to ask your doctor what treatments are available if this treatment stops working. Would that be okay? Now, my dad could say, I don't want to talk about it. He never did, but he could say that, in which case I would say, okay, well, I'm going to ask you again before the next visit. The consent conversation can be particularly helpful if you as a caregiver are concerned about the health-related behaviors your care partner is or is not engaging in. And by that, I mean, Are they eating healthfully? Are they smoking and they shouldn't be? Are they drinking too much alcohol? Are they not taking their medications? Are they not exercising? And it's, often patients don't disclose these things to healthcare professionals, and we understand that. We all, as caregiver patients, don't always tell our doctors the things we're doing or not doing. But if you're concerned, you could use the consent conversation to address this. It could sound like this. Babe, I'm concerned about how difficult you're finding it to remain adherent to your medications. I think it's important that your doctor knows you aren't taking them daily. We mentioned this to him next week. All right, so that's the first tip. Healthcare communication is so prominent throughout our caregiving journeys, but it is most important when we potentially step into the role of healthcare proxy, when we are tasked with bringing our care partners' voices into the room. And the only way in which we can bring our care partners' voices into the room is if we know what those voices would say. And the only way we can know what those voices would say is to ask. And asking is difficult because asking invites an elephant into the room. And that elephant is death. None of us want to be talking about that, of course. If you are a caregiver who wants to open a conversation with a care partner about the umbrella term of advanced care planning, which means all the care that someone might want to receive both now and in the future, it includes the execution of advanced directives, healthcare proxy forms, DNR orders, but it's a much bigger idea. If you are a caregiver who wants to open these conversations but don't know how, I encourage you to set the agenda. Setting the agenda is something that we can practice in advance of a conversation. It allows us to put out on the table what we want to talk about and why. With my dad, it sounded something like this. Dad, I know this is hard to talk about, but I would really like us to discuss what type of treatment you would like to receive in the future if we can no longer control your symptoms of LBD. It's important for me to know what you want so that I can be sure to carry out your wishes if you can't tell the doctors what you want at that time. We talk about them. Now, again, my dad could have said no, in which case I would have said, okay, I'm going to ask you again next week. What I want to drive home right now for all of you, especially those of you who've already had these conversations, is that this is not a conversation you're having once or even twice. This is a conversation that must be repeated because goals of care change. What my dad wanted for his care in 2011 is dramatically different than the care he wanted in 2019, the year he died. And had I depended on his 2011 wishes in 2019, well, I never would have been able to work to ensure that the care he received was ultimately respecting those wishes. So these are conversations that must be repeated. All right. I know that my bringing up goals of care, advanced care planning, and an elephant in the room, death, is very distressing. And so this is a perfect moment for me to very briefly review with all of you one of the most powerful and simple stress management techniques for caregivers, and that is the deep diaphragmatic breath. This is taking a very deep breath in through your nose, holding it for 4 seconds, and exhaling slowly through your mouth. Now, there's iterations of this called box breathing. You can find lots of examples. The whole idea, though, is you want to breathe in through your nose, hold it, and then out through your mouth. The reason is that when you breathe in through your nose, you are bringing oxygen to your brain, and that oxygen is lowering the stress hormone cortisol. I can't see your faces. I encourage you all to practice this breathing while I continue to speak. The National Alliance for Caregiving conducts studies every 5 years canvassing caregivers in the US. Their last data came out in January of 2020. It means their next data is coming out in just about 2 months from now. But their 2020 data, these were pre-pandemic data. And what I want to just highlight for you, in 2020, 21% of caregivers said that their health was fair or poor, and 36% said that they had experienced high emotional distress. And these two figures together represent an incredible red flag. Not surprising to me, but very, very concerning. Without support, We all as caregivers represent the next generation of patients with chronic or life-limiting illnesses. And part of the distress we experience is psychological. And of course, I as a clinical psychologist have focused my career on addressing the psychological component of caregiver burden. And just because I'm a psychologist doesn't mean I was immune to it. In fact, I experienced incredible distress and burden across my entire caregiving trajectory. This picture keeps popping up every January. I took it in January of 2019. My dad died about 4 weeks later. And when I took this picture, I was feeling so many of the things that my patients tell me they feel. I was feeling exhausted and lost, burnt out, powerless, alone, all of these things. What I want to emphasize to you right now is every one of the words in this word cloud, every emotion up here is normal. We all feel them because we are human. In fact, I get much more concerned when I meet a caregiver who says to me, Dr. Appelbaum, I'm in this really hard situation, but I feel just fine. Well, to me, that's a red flag. So these feelings are normal. And most of us don't choose to become caregivers, or we don't get to choose the situations that we're thrown into, right? Most of us are, this is just what is, it's handed to us. But the third lesson I want to share with you is that if we are going to be exposed to negative emotions as caregivers, if that is part of our journey, well, let's learn from the emotions, because emotions are messengers and they can teach us how to live our lives more fully. And so we as caregivers can actually capitalize on the emotions that we experience as caregivers, actually grow. And I'm going to give you 2 examples I hope you can take with you just today even. This is for everyone in the room, not just caregivers, but I'm going to focus on caregivers here. The first emotion is anger. If you're a caregiver, you have every right to feel angry. You have every right to be angry that your life has been put on hold, perhaps dreams have been deferred, can't plan for the next year or month or week or day, or when my dad was hallucinating, it was the next hour I couldn't plan for, and that is maddening. And that anger must come out. And I'm not suggesting that you go yell at your care partner. That's not what I'm saying, but I am saying go yell into a pillow, or close the car door and yell, or get it out in a therapy session, or with a friend, or in a journal. The anger must come out. What I want to highlight is that anger is rarely unidimensional. I was working with a woman who told me that she was so angry at her husband. She was so angry because of his cancer and the treatment he had received, he could no longer physically do the things he once did around the house. He could no longer travel. They could no longer have sex. They could no longer be the couple they once were. She was so angry at him. And yet, as she expressed this anger to me in session, she started to cry. What we realized was that every time this woman saw her husband debilitated and weak, she was grieving for the man she once married. For this patient, as it is for all of us, beneath our anger is very often a very deep well of sadness. Once she allowed that sadness out, her anger dissipated. I encourage everyone in this Zoom room here, the next time you feel anger, whether it's about caregiving or anything else, I want you to ask yourself, what am I grieving? What is the loss I'm facing? Can you allow some of that grief out? What you're going to likely find, if you can, the anger is going to dissipate. The second emotion I want to talk about is guilt, because it would not be a talk on caregiving if I didn't touch on guilt. Now, I know my patients feel guilt when I hear the woulda, shoulda, couldas. Dr. Appelbaum, I should not be here. I'm not the patient with cancer. Dr. Appelbaum, I shouldn't be here. I should be at his bedside. And when I hear the woulda, shoulda, couldas, I hear my patients telling me that they feel like they're letting their care partner down in some way. But that's wrong. Guilt is a powerful red flag that we have neglected our own needs. When we feel guilt, it is actually a wrong way sign. it tells us that if we were to keep going in that direction and actually listen to it, we hurt ourselves. Instead, the next time you feel guilt, and we're so good as caregivers of feeling guilty, the next time you feel guilt, I want you to ask yourself, in what way am I about to neglect my own needs? And can you make a commitment to going in the opposite direction and meeting your needs instead? Now, I want to acknowledge, of course, I said all of those emotions are normal, and they are. And of course, it's important to know when to seek professional support. And I'm a very big fan of mental health care, no surprise. It's important to get support if your distress you experience prevents you from getting out of bed. If it prevents you from working, if you have paid employment. If it prevents you from taking care of your care partner, it's time to seek help. I provide a list of resources in the 10th chapter of my book and describe the different types of support out there for caregivers. The website psychologytoday.com is also a great way to very quickly find a therapist in your neighborhood who takes your insurance. But I do strongly encourage those of you who feel distressed and are struggling to get support. There was no way I could have gone through my caregiving journey without being in therapy myself. I want to go back to this picture for a moment because I was thinking about why I took it. You know, why I took this picture. I took a lot of pictures of me and my dad, lots of pictures and videos, but why this specific picture? And I remember the reason I took it was not because I was feeling distressed and burdened and isolated and sad and helpless, which I was feeling, but I was feeling something different. I was feeling incredible pride. I was feeling so much pride in the fact that I had taken care of my dad on my own for basically 6 years. Proud of the fact that I was able to survive what was unfortunately a very intense period of trauma and loss. My mom died very suddenly soon after my dad's diagnosis. And I was left to take care of everything in the face of trauma and grief. And I was so proud that I was able to give him 5 or 6 years of life that were meaningful and beautiful. I'm proud that we had been able to continue to grow in our relationship as father and daughter despite so many challenges. And in that moment, I was feeling what has become such a theme in all of the work professionally I do, what so many of my patients have experienced, and that is that meaning and suffering can coexist. We can have incredible experiences of suffering and also experience meaning. Whenever I talk about this idea, I like to illustrate it using what happens to be my favorite dessert. Not sure if anyone in the Zoom room enjoys creme brulee, but for those of you who are not creme brulee aficionados, when it's done properly, and it rarely is, it's crispy on the outside and it's creamy on the inside, it's cold on the inside and it's hot on the outside. When you take that first bite, there is so much going on. This is how I think about the emotional experience of caregiving. One big emotional creme brulee. At any one time, we can feel sadness, fear, and anger, and helplessness, and love, and hope, and strength, and connection. The suffering and the meaning, they can coexist. And there are routes through which we as caregivers can connect and reconnect to meaning. I go into great depth in my book about them. I want to give you a few of them right now. And the first is through what we would say choosing our attitude. Now, I'm guessing most of you in the Zoom room didn't choose to become a caregiver. We don't choose to get Lewy body disease or Lewy body dementia. We don't choose to get cancer. We don't choose to become caregivers. We're thrown into this role, let's be honest. But what we have choice over is how we face the role day to day. And my dad was my greatest teacher when it came to attitude. You know, stuck in the hospital, if he was oriented and felt well, that hospital food tray was a great place for the chessboard. When he first came home after the coma, he couldn't stand up, but he could exercise his arms and strengthen his arms. That was attitude. Choosing how to respond in the face of suffering, that's what you have control over, that's your attitude. For many of us, as it was for my dad, attitude means setting goals. He had a goal when he emerged from coma to eventually walk down the boardwalk by the New Jersey shore on his own. And for weeks and months, he would practice walking in the hallway with a home health aide. This is a video. I came home from work one day. They're just walking down the hall. And he achieved his goal. He got to walk down the boardwalk on his own. That's attitude. That's one route to meaning. Thinking about how you can choose your attitude in the face of the suffering that caregiving creates. The second route to meaning is through reconnecting with your authentic sense of self, with what makes you you. You know, so many caregivers, I'm sure some of you have felt this, they say to me that they've become deeply disconnected from who they are because of caregiving. That they don't even recognize themselves because they can no longer work full time or travel or engage in the activities that once brought them a sense of meaning and purpose. But then I would ask, well, has caregiving changed who you are authentically deep down? As a loving or caring person, as an artist, a lover of nature, as an athlete? And the answer is probably no. Again, my dad was my greatest teacher. Stuck in his hospital bed, he still practiced conducting. He was still a musician despite the fact he didn't have the energy to sit up and play the piano any longer. And I followed in his footsteps with attitude. I had a first career actually as a ballet dancer. And during his long hospital stays, there was no way that I could leave to take a ballet class. But the bars on his hospital bed made a great ballet bar for me. That's attitude, realizing how you can make the most of the circumstance you're in. 2 months after he died, I got back up on stage and I danced for the first time in years, wearing his clothing and carrying his cane. That's attitude. I got off stage and I cried. Suffering was there, but so was the meaning. So authentic sense of self, reconnecting your authentic sense of self, that's a big route to meaning, as is honoring the ways that you've grown. Sort of joking when I say this, but I'm Allison 6.0 speaking to you today. It was Allison 2.0 who began her caregiving journey. I have emerged from caregiving a much stronger and more grounded version of myself. And I have lost track of the number of caregivers who have as well, who said to me that they had no idea they were that strong until they became caregivers. Or caregivers who said to me they found their voice because of caregiving, because they were once shy, but they've had to speak up with so many healthcare professionals. Now they're outspoken. You all will develop strength and grow as a result of caregiving, and that is meaningful. We can connect to meaning through how we take responsibility for our life. Nobody's going to do it but ourselves. And that means redefining what self-care means. I do a whole talk on self-care. Self-care is a phrase that gets thrown around a lot. But I dare to say for us as caregivers, self-care is anything that we can do to protect our energy. And that means setting boundaries. You know, that means cutting people out of your life who don't buoy you up, who don't support you. And that means asking for help. And when you ask for help, I encourage you to be as specific as possible. The more specific you are when you ask for help, the more likely it is that you're going to get help. And taking responsibility for your life means allowing yourself to delegate and lean on others, which I know is so hard. We as caregivers have a hard time giving up control, but you must do it. Picture was taken on March 1st of 2019, the day that was my dad's 97th birthday. He died 6 days before, so he didn't make it to 103. This is the team of home health aides, or most of the home health aides who were taking care of my dad. I had them over to celebrate them and to thank them. And I share this because I could not have gotten through my caregiving journey without a team of home health aides. That's in part because I had gone through incredible loss and did not have family available to help. But I put the picture here to remind you that your team might look different, but you need a team to do this. And having this team allowed me to remain connected to my role as Allison, Stan's daughter, not just Allison, my dad's caregiver. Allowing yourself to lean on others will allow you to reconnect to the meaning in your relationship with your care partner. And one final route to meaning is simply through your 5 senses, through what you see and touch and taste and smell and hear, through feelings of love, through visions of beauty, through a tight handhold or hug, through humor and laughter. We can feel connected to one another and connected to something greater than ourselves. Now, as you can see, my dad and I were very, very close. That's an understatement. He was my best friend, my soulmate, my everything in life. But you can have a terrible relationship with your care partner and still connect to meaning through your 5 senses. It is as simple as when you're stuck in the emergency room, you put your earbuds in and you turn on your favorite music and you close your eyes and you allow yourself to be transported to your favorite concert hall. Or you leave the hospital and you feel the sunshine on your skin and you are reminded just for a brief moment of the connectedness to nature. Or you take a sip of your favorite tea and you remember what it was like to drink that tea in your grandmother's house. And you allow yourself for just a brief moment to be transported. These are ways that you can connect to meaning through your five senses. It's always available to all of us. I'm going to end with one final lesson that really became clear to me after my father's death. And it's a lesson that I think was driven home because my dad had Lewy body disease and because of his hallucinations. But every caregiver will learn this lesson. And that is that caregiving gives us endless opportunities to practice saying goodbye. Every time I said goodnight to my father, I practiced saying goodbye. Every time I left the hospital, I practiced saying goodbye. Every time he was taken for a medical scan or evaluation, I practiced saying goodbye. And with each opportunity to practice, I learned to live my life and my life with him more fully and vulnerably and meaningfully. And for that, I remain very grateful to caregiving. Thank you all so much for sharing this space with me. You can find me online, social media. This is my book. I hope you'll enjoy it. I hope you find it meaningful. And I'm going to stop sharing slides so we can all hopefully have a rich conversation together.
Thank you so, so much for that amazing session and discussion. That was just excellent. And thank you all. You notice they're giving you some reactions there.
Thanks for the emojis, guys. You're making my day over here. They're much needed, much needed.
Absolutely. Absolutely. That was so beautiful. Thank you for sharing your story. I really, really appreciate it. And so what we're going to do now, you guys, is we're going to bring on a couple of panelists here to have a little bit more of a discussion around this. So Judith Kowaleski is a former academic librarian who earned her Master of Library and Information Science from UC Berkeley, as well as a Master of Arts and Theological Studies from Franciscan University of Steubenville. She retired in April 2018 to care for her husband, who was diagnosed with Lewy body dementia. Like many people, Judith had never heard of LBD until it struck her family. She utilized her research skills to navigate his care and was fortunate to be able to keep living at home until 6 weeks before his death in September of 2023. Since his death, in addition to remaining active with the LBD Caring Spouses online forum, Judith has volunteered with the LBDA to increase public awareness and help others navigating LBD. Thank you so much for joining us, Judith, and thank you for all of the volunteer work that you do for us.
You're welcome.
And then, absolutely. And then we're also joined, I'm going to add a spotlight here for Craig. Now we've got our Brady Bunch squares in. I'm dating myself, or maybe people in our audience who don't know what that means. Craig Denham is a caregiver for his wife, Donna. You guys might remember her from a webinar we had earlier this year. And she was diagnosed with early stage Lewy body disease. She is only in her early 50s. As a business owner, Craig balances caregiving with work, sharing insights on the challenges families face, from getting an accurate diagnosis to planning for the future. Craig advocates for tenacity, empathy, and support for those impacted by Lewy body disease. And so I want to thank you all so much for joining me. I think that hopefully we've got, three very different perspectives kind of on the same journey, three different paths maybe to the same journey. But I think all of you have so much to share. So thank you so much for being with us. Okay, so the first question I wanted to ask, and like I said, the panel has the questions. They also know that they can reject any question they want. They have full veto power. So, I think a lot of things that Dr. Appelbaum talked about and a lot of things we recognize in caregiving is that it can really alter your sense of identity being a care partner. And that can be in good ways, that can be in different ways, but kind of recognizing those different things about yourself. So the question is, has your experience as a care partner altered your sense of identity? And if yes, then how so? So anybody want to go for that one first?
I'll go. Yeah, I think the one thing is that I'm even stronger than I thought I was. My husband's onset was very sudden. I went to work one day, and while I was at work, he drove himself to the emergency room and ended up being in care facilities for 14 months. um, we were fortunate that it only took about 4 months, 3 months to get the diagnosis. Um, and so, all of a sudden I'm in charge. Although I don't have any medical training, I learned that very quickly that I probably knew more about Lewy body dementia than many of the medical professionals I was dealing with. And I never ceased to be an advocate for him, even when he was in care facilities, because there was just this, lack of understanding. And, uh, as Dr. Appelbaum said, he could not provide the information they needed. So I had to be there all the time. And, if anybody had shown me what it was going to be like, I never could have imagined it. But I was, I think, a good caregiver, even without any training at all.
Absolutely. Thank you so much for sharing that. I think that that really speaks to what Dr. Appelbaum was sharing too, of finding that strength, finding that resilience, finding that meaning. So thank you. Now, Craig, you're in a very different place because Dawn is still pretty early on in her journey. So, do you feel like being a care partner has altered your identity in any way, good, bad, or otherwise?
I wouldn't say that's really altered my identity yet, but it's definitely changing roles. Assuming a lot more that what she had done in the past. I'm finding it kind of like Judith said, excellently. You find the strength and realize that you've got to pick up and do the stuff. You just pick up and do it without thinking too much about it. And if you had, like she said beforehand, if you had known, you'd say, okay, there's no way. But even on the early stages, you find yourself, getting involved and doing things that you really didn't think you would be before.
Mm-hmm. Absolutely. What is the joke that Donna makes? Something about, I think you guys had asked her to pick something up at the store and she forgot. She's like, well, don't ask the person with dementia to remember the grocery list.
Yeah, that's right.
Talking about some of those changing roles.
A lot of humor in it. I mean, we're able to. So, I mean, we have to laugh it off. I mean, it's horrible, but we try to find the silver lining in it as best we can. We really try.
Absolutely. Thank you. And then Dr. Appelbaum, anything you want to add to that?
Well, it's sort of been an elephant in the room for me, and I talk about this in my book. I joke about the term me search. So here I was, doing all this scientific work in family caregiving, and then I, am thrust into the role. So there was so much overlap and interconnectedness between my professional and personal lives, but inevitably it was my personal caregiving journey that has inspired my career moving forward and has really motivated me. I have very large career aspirations. Part of the transition that I just made is my goal is that in the next decade, every healthcare system in the US has caregiver support. And that's really what I'm working on right now, because I was never once offered support. And let me say, my dad was receiving care, not at Sun Kettering, I'm not going to name the place, it wasn't MSK, but it was at a hospital where I was on faculty. And yet I was never offered any support. And that is unacceptable. And so my personal experience is really just a huge motivator. It's lit a fire that's there. And then, I think like Judith shared, I remind myself, and as I go through new hard experiences, as it's been 5 years since my dad died and lots of life has happened, but I realized that I have such incredible strength inside that was really engendered by what I went through as a caregiver. So I'm grateful for it.
Excellent. That's such great insight to share too, I think, around, just all of your journeys and recognizing that strength that a lot of times you don't know until it gets challenged. Thank you all. So with that, then with those challenges, what have been some of the most challenging parts of your roles and responsibilities as a care partner?
I think for me, the biggest thing was maintaining my own physical stamina, because I was 73 years old when I started caring for him 24/7. And as time went on, it became more and more draining. And the last year, I was existing on like 2 or 3 hours sleep a night. And I didn't even know how bad it was till somebody gave me a Fitbit. And it's like, oh my goodness, it's really horrible. Um, and the other part, I think, was taking charge in a way that maintained his dignity, because he was such a dynamic person, and he never ever admitted there was anything wrong. So that made it difficult too. So I walked a fine line between keeping him safe and doing what had to be done and not hurting his feelings. Um, but one thing that helped me is uh, most of our doctors were in a health system where there was an online portal. So I could communicate with the doctors, and he didn't even have to be involved. So they knew what was going on, and I didn't have to share that in front of him. So that was a very helpful tool.
That's a great tip. And I know you
Yeah,
talked a lot about communication, Dr. Appelbaum, too, and making sure that you're trying to get those messages across. But those
yeah,
online portals can be really helpful.
yeah.
Thank you. All right. And then, Craig, do you want to comment to that? Probably not having a lot of challenges yet, but
Yeah. I'd say mostly probably right now it's just emotionally, because it's still a roller coaster, and not just with me, but with Donna, because I want to make sure that being strong for her, because it really overwhelms her at times where I don't need both of us going into that spot. So I got to keep, you know, comfort her without being overly emotional about it. I may not probably say it anyway. I'm sure I'm being analyzed by Dr. Appelbaum right now, but that's
I'm off the clock, Craig.
okay. But really, just being emotionally strong. I mean, that's probably the most difficult challenge right now.
Yeah.
yeah, I'm sure. I'm sure. And you guys are such an amazing couple. I mean, seeing you together is always so beautiful, but I know there has to be those quiet times too that are difficult. For sure. And then Dr. Appelbaum, anything you want to add to that? That was, I think you kind of covered your challenges, but
There were so many. I'm thinking of an anecdote that comes to me that has to do with my dad's hallucinations. There was one day I came home from work, and I went to his bedside, and he turned away from me in anger. And my dad and I had this very incredible special relationship, so it was so surprising to me. And I asked the home health aide what's going on, and the home health aide said to me that he had hallucinated me all day long, sitting at the edge of his bed silently. Now, his hallucinations, like many LBD hallucinations, the characters don't speak. And so he had basically hallucinated me not speaking, which is literally not in my repertoire. And it was so painful for me to try to repair a part of our relationship that was broken outside the context of my lived reality. And moments like that, where our relationship was damaged, but because he had been hallucinating, were very, very painful. I mean, there were so many challenges, but that's a new one to share that I think is just very unique to LBD.
very, very much so. Yeah. And that I think is, we just covered psychiatric symptoms pretty recently. And, so many of those hallucinations and delusions involve, like you're saying, anger, fear, paranoia of something around the care partner, because you're the person that's there. And that can be really, really hard to cope with. Thank you for sharing that. With that, I mean, you guys have kind of commented to this, so if you don't feel like you want to add anything else, that's okay. But, what are some of the strengths that you feel like you gained through your experience as a care partner?
Well, I think for me, I mean, my journey's over. My husband died a year ago. I'm much more patient with other people. Not that I was always perfectly patient with him. I was not the perfect caregiver, but in general, little things just don't upset me anymore. And I'm also, I think, more aware of the needs of others. And if they seem like they need help, I don't just say, like, call me if you need me, but I'll say, here's something I can do for you. And I'm much more assertive in letting them know that I really do want to help. And also in this journey, we downsized and moved into a very small home in a retirement community. And I realized how little you really need in life to be happy. And I felt kind of bad because, I mean, we didn't live in a mansion, but we had a 4-bedroom house and we went to a 4-room house. And I said to him one day, are you really happy living here? And he just looked at me and said, well, you're here, aren't you? And I realized that's all we really needed, that as long as we were together, it was home.
That's really beautiful. Thank you. Those are good words to remember for sure. And then Craig, anything you found as far as strengths so far?
I actually going almost verbatim and say what Judith said. My patience level has really, really. I've not historically been a patient person, but I've learned that even with Donna, as her disease progresses, emotionally, there may not always be reasons about why she's feeling what she's feeling. For example, sometimes she'll just get angry, and we've kind of gotten to the point. Used to, if she was angry, I knew she was angry at me. And she'd say, oh, nothing. And, it really was something. And eventually she'd tell me what it is. But now it really may be nothing. It's just part of that roller coaster. So I've learned to kind of try to read that and be more patient. And, when she gets around, she'll tell me, okay, I don't know why I was feeling like that. I just was. And so that's really, really a big part, I think, of being a good caregiver. Is just realizing that you have to be with them wherever they're at the moment.
For sure. For sure. As therapists, we call that therapeutic use of self. And I think there's an element of that also in being a care partner, of kind of using yourself and your presence in a way that is supportive at that time, at that moment, which sometimes can be hard to read. Yeah. Thank you. How about for you, Dr. Appelbaum? You talked a lot about your strengths. Any other hidden superpowers you found in there?
Well, just love those that Judith and Craig said, and they resonate for me. I'm an expert multitasker. That's due to caregiving. And I am really good at listening to my inner voice and listening to what it's telling me and saying no. I've gotten really good at being honest with myself and others about my needs. And I think that's because I realized as a caregiver, I did not have the luxury to waste energy. And I've been able to really carry that forward. So that's been a gift.
That's a huge gift to get. I think we turn those messages off way too much. All right. So our next question here, what has been the most meaningful part? Dr. Appelbaum talked a lot about finding meaning in caregiving as your experience as a care partner.
Well, I think for me, we had a good marriage. It was a second marriage for both of us. We married late in life. But during those final years, I realized how deep our love really was. And sometimes we'd look at each other in the midst of something negative or maybe a little messy, and we'd talk about the things you could never have imagined on your first date. And in his better moments, he was so appreciative of what I did for him. And even though it was hard, I realized that the difficulty I was experiencing was nothing compared to what he must be going through. And so, even though it was the hardest years of my life, it was also so rich and so full in so many ways.
Thank you for sharing. That's really beautiful. Well, you guys make me get a little misty-eyed. All this beautiful stuff about these relationships. How about for you, Craig?
Just putting life in perspective, that, all the little bitty things that we used to be worried about, stressed about, concerned about, you realize are really not important. It's kind of much more the big picture. And I was very, very guilty of, letting things be distractive and worried about things that really just don't matter. And it kind of really puts that in perspective about what really matters in life. In general, enjoy the time you have. You've got a good day, enjoy it. I mean, get out and have fun.
Well said. Well said. A good reminder. And then Dr. Appelbaum, for you, some of the ways you find meaning.
I mean, for me, it was my dad and I grew in our relationship. We had always been best friends, but our relationship got stronger and better each day. And the day he died, our relationship was better than the day before. And I think that caregiving forced some very complicated scenarios. I wrote about one in my book, which was, the last thing my dad ever wanted me to do, and the last thing I ever wanted to do was change my dad's diaper. But we were in a situation where that had to happen a few times. And it presented the opportunity for us to face emotions together and to be a team and to really be honest and authentic and vulnerable. And we just really learned to make the most of the situations we were stuck in. And that was just a daily gift.
Absolutely. Well said. The last question here that I have for you guys is I noted in Dr. Appelbaum's book that she references a favorite author of mine, Pema Chodron, who has written a lot of beautiful things. I think When Things Fall Apart was one of her first books that is really just it really helps put perspective a lot of what you guys are talking about here. And so I was wondering for each of you, if you have any books, quotes, blogs, resources, that kind of help you find that sense of shared humanity or validation in challenging times, or anything you want to share as far as something that brought you some comfort.
The book that I got a lot from, and it's one that a lot of people know already, I'm sure, is Loving Someone Who Has Dementia by Pauline Boss. That one was very helpful to me. But other than that, just the LBDA website, just the resources on there are so great. And I was part of the LBD Caring Spouses group, and that provided me with such great support as a caregiver and emotionally. And I'm still on it, even though I'm no longer caring, just because sometimes somebody asks a question that I can provide an answer for. And I actually met a woman who lives in my town, and we have now become best friends. It's so weird. I mean, we say it all the time. It's so weird the way we met, but we had interests in common and friends in common, but somehow had never met. She is still caring for her husband, but it's just amazing when something really good can come out of something really bad.
Absolutely. That silver lining, as Craig said earlier. And you guys, if you want to find out more about any of our groups via LBDA, you can reach out to our support services line and they can help you find those groups that Judith is referencing. And then Craig, how about for you? Anything that gives you some comfort?
Well, first, I'm going to do the same, give you a shout out to LBDA, because when we first started looking and trying to get information, that was really the first definitive source we found that really delved into the Lewy body disease. So for that, very much appreciated. But as far as a book, I'm very anxious to read Dr. Appelbaum's now. Can't wait to get it and read it. But one I kind of found in the beginning was Caregiver's Guide to Lewy Body Dementia by Jim and Helen Whitworth, which I thought was a great aid at the time. And actually, I probably need to go back and reread it now, just because as you get into continue on, you always pick up different bits and pieces just depending on where you're at, what's going on at the time.
Oh, for sure. Yeah, because Dr. Appelbaum mentioned how it's a changing journey. So yeah, probably be different nuggets at different times. Excellent. And then Dr. Appelbaum, anything that you want to mention as far as Pema Chodron's books or any of the resources? You had a great list, I thought, of suggested
Yeah, I have
references.
a list of resources of books that I found helpful or that I think could be helpful. So those are listed. Pema Chodron's books I really drew on because they really get at the heart of the powerlessness that we as family caregivers face, and how can we as humans sit with the fact that ultimately we're not in control, which I know is just so hard. And so I really appreciated her writing on it. So it's just, it's a good reminder. It actually, I have to be honest, listening to this reminds me, like, it's time for me to reread Pema Chodron. Like, I think it's time. I need my brush up. It's been 5 years. I think I need to go back and reread. So.
That's funny. I was thinking the same thing. I was like, it's been a while. It's been a while.
Time.
Absolutely. All right, you guys. So I'm going to turn to some of the questions that we got here in our Q&A today. And so Dr. Appelbaum, you mentioned getting your father on Medicaid. How is there a way to get someone on Medicaid if you have resources? She's saying that they're going to go through everything they have and she feels like she'll be left with very little.
Yeah, so I think one of the challenges is that, as you likely know, in order to get onto Medicaid, you need to basically be at the poverty line, which is not necessarily the case for all of us. But just because you're not at the poverty line doesn't mean you actually have the resources available to live and to pay for your medical bills and your food and your rent and everything else. And so, and some of you might be thinking, well, her dad was involved in Stand By Me. Why'd they have to get onto Medicaid? Let me be very clear. The music industry in the 60s was a lot different, and he didn't get royalties, unfortunately. Otherwise, I might not be working in the job I am, sort of joking. But what we did, and what I talk about in the chapter, is the idea that my dad was basically had a pension and Social Security, and those two together were way above the Medicaid limit, but was not enough to cover all of his needs. And so we eventually worked to get to house any surplus funds he made above and beyond the Medicaid limit in what is called a pooled trust. And pooled trusts are legal ways in which you can separate money that would then allow you to actually qualify for Medicaid. Every state has regulations around pooled trusts. And in that chapter, I actually provide some website links and information about a search engine that you can use. It's state by state to search legal groups that can assist you to get a care partner onto Medicaid. I, in New York State, went with a New York Legal Aid Group, NILAG, and these were pro bono attorneys who particularly were versed in elder care, elder attorneys, and Medicaid. But there are ways in which you can put the money one has and the funds one has above and beyond the Medicaid limit safely in a trust. And then what ended up happening is once that was set up and once my dad was on Medicaid, you can use that trust like you would a bank account. And so then I used the trust to pay for my dad's, co-pays for medical bills, his food, sometimes other expenses related to his care. And so the money gets to be used. It just has to be placed in a special trust.
Thank you.
I hope that answers the question.
Yes, very much so. Thank you. And you guys too, you can always reach out to our support services team. We have 2 social workers who man that line, and they can also probably help you find those resources if you're struggling.
Social workers are your best friends. Let me just emphasize that the only way I eventually got my dad on the Medicaid, the silver lining, the first hospitalization after my mom died, I broke down hysterically crying with the social worker, and the social worker was like the oracle. Gave me all the information. So social workers are your best friend. Yes,
I keep as many as I can on speed dial on my phone at all times. One of which is on this call today. Lance Wilson, will shout out, did our ambiguous loss webinar before, and I keep him on speed dial. So Judith, I'm going to pass this question to you because I think this is an excellent question, and anybody else that wants to comment, please do. How did you take charge without hurting his feelings? She said, my husband doesn't admit that anything is wrong, and he always was the better decision maker.
Well, in the early part of the illness, it was like a sudden drop off. And I actually had to become his guardian. We did not have a POA. And I had to become his legal guardian, and he was declared incapacitated and was really pretty out of it for a while. And then as he was put on a medication that just kind of turned things around. And then for several years, he was pretty good. But here I was, his legal rights have been taken away. And, his children said, well, get rid of the guardianship. You don't need it now. He's more with it. But I thought, no, I'm going to keep it because it makes things so much easier. And at that point, I just, kind of talked to him about what was going on and why I had to do things this way. And he just kind of went along with it. I don't know. I mean, I never made a big deal about the fact that I was in charge. I just did things, and he accepted it. I'm sorry, I don't have any more to offer than that. And I always included him. When we sold our house, he wanted to be there at the closing. And I said, okay, fine, honey. And he sat at the table, and he even signed the papers, even though all they needed was my signature. And it made him feel like he was present. And he even had a good suggestion, which made the closing go better. So, every now and then the mind would kick in. So I just, I treated him like he was still in charge, even though I really was. And I think you can just quietly do things maybe and make sure things happen without making a big deal about it, I guess was the way I did it. The only time I had to do something that he didn't take well was he had a driver's license, but he wasn't driving. And that was fine. But his doctor said, just let me know if he ever gives you a hard time and we'll let the PennDOT know. And so I reached a point where he was starting to act like he was going to jump in the car and drive. And so, the papers came in the mail. We want your license back. And he was very upset and said, did you do this? And I said, no, it must have been one of your doctors. And I told him, well, maybe it's your eye doctor because, your vision isn't what it used to be. So I didn't make LBD the reason. And
Mhm.
he signed the paper. We got it in the mail that day and the license was, but, I just think you have to, creative lying is good too. I have to admit I did that when I needed to, or just anything to smooth it over for him.
Yeah, well said. That's good advice. And Dr. Appelbaum, anything you would add to that?
I loved your answer. Yeah, great job. Bravo. Yeah.
Excellent. Excellent. And Craig, I think this next one is right up your alley here. So this individual is asking for any good coping mechanisms kind of during the prodromal period. So her husband doesn't really bring up the possibility and keep silent about it, but she's really researching answers. And so the assessment and diagnosis is really months away. They've kind of pushed that out. And I know with Donna, you guys had kind of a rocky and long path to diagnosis. So anything that helped you cope in those initial phases before you had the diagnosis?
Oh, wow. As far as coping with it, one, you just have to learn to be persistent because unfortunately the medical system is not very well suited for dealing with Lewy body disease. It's very difficult to diagnose and symptoms are so varied and even doctors are very, very uneducated. So we hit that. So just brace yourself as far as just being persistent. That's the big thing. But as far as just coping with the uncertainty, it's tough. We just got out and we tried not to focus on it. When it came to our doctor's appointments and stuff, we tried to go in and be prepared because dealing with them, most of them, like I said, weren't very well informed. So often we were informing them, and that didn't go over very well. A lot of them weren't very receptive. So we would just be prepared, keep track of your information. If you're having symptoms, just say, hey, this and this happened on these dates. And just, gosh, get out and de-stress as much as you can. Don't focus on it.
Excellent. Yeah. And you guys remember too, I'm not sure what stage you're in, but our comprehensive symptom checklist and our diagnostic symptom checklist can be helpful for taking in to doctors. And, I kind of give a piece of advice a lot of times that there may be doctors on the line that don't appreciate this. I'm not sure, but the number one thing you have to be able to do with your healthcare team is communicate. And if someone is not willing to communicate with you, listen to you, talk with you, I would that right there, I don't care how big an expert they are, I would find someone else. That's always been my rule of thumb. You've got to be able to communicate. That's like first and foremost. So good advice, Craig. And I hate that you guys have to advocate so much and really do that. But I have to say, even like I've said, I have a daughter with autism, same thing, like constant advocating all the time and educating. So it's the nature of the beast, unfortunately. This question I'm going to see. I think that probably Allison and Judith, you both have some experience with this. So how do I know when to hire help? Because, there's a lot of ups and downs with Lewy, right? A lot of fluctuations. One day might be great, one day might be awful. The downs are dramatic and usually lead to hospitalization and rehab. So kind of how do you know when it's time?
Well, I did
So
it
for
pretty
me,
early on.
you go first.
I did it pretty early on, not so much for him, but for me. I got someone to come in one afternoon a week so that I could go out and just be away from him for a few hours. And he was resistant. But I said, well, she's here to help me more than for you, because it's like I don't need a babysitter. But then that sort of was the gateway to later on adding more. So I would say sooner rather than later, just to get things started. And then as time went on, my husband was a veteran and we got into the VA health system, and they offered me 12 hours a week. And I said, I'll take it. So they began paying for this woman and then, 9 more hours. And again, it was before things got really bad, but I said, anything that's going to relieve me is going to ultimately help him. And I think don't wait too long, because you need that break yourself, for one thing. You just cannot do it without a break. So that would be my advice.
Thank you very much. And Dr. Appelbaum.
I mean, it's very similar. I mean, the decision to bring in home health aide was really based on my own needs, actually. I mean, there was no way. This was long before the pandemic, when working from home wasn't a possibility. So the only way that I would be able to maintain paid employment and take care of him was to have a team of home health aides who could be with him during the day. And it was also clear, going back to what I shared about changing his diaper. I mean, my dad, he wanted to maintain his dignity and boundaries. And the only way for us to do that was for me not to be involved in his toileting or bathing or dressing. And so it was really, very early on that we had home health aides involved. And I'll just say again that I think that the more help you can get, the better, because ultimately even if you feel like you don't need as much help now, you will, and you're going to find things that you can delegate that ultimately will free you up to be more engaged with them.
That's a great point. That's a really great point. Last question here. So, and I think you all probably have a way you can comment to this. So, Dr. Appelbaum, you talked about all the opportunities to kind of practice saying goodbye. And we were talking here in this moment about kind of planning ahead for home health care. But this individual says, I find I'm constantly rethinking whether or not I should quit my job, like kind of going back and forth. So, advice on how to stop kind of sweating things and decisions and trying to be more present in just the here and now. I think you all might have a little different perspective on that. So, Craig, I know you've had to kind of work on that a little bit as far as just kind of staying present and not getting sucked into it. So how do you do that?
Again, folks, you quit worrying about the small things. A lot of things that used to. I mean, most couples do it. You argue about what you want for dinner. Now it's no big deal, or what you would go and do. So we really just focus on the day to day, where we're at the moment, and that's what we worry about. As far as how to plan beyond that, it is a little difficult, but we kind of we pick and choose our goals now. Have discussions on them when we can, and we decide which ones are attainable, which ones really try to put them in perspective now. We keep our bucket list, and that's what we'll still focus on our dreams and things we want to do. We don't lose sight of that.
That's beautiful. Thank you. And then Judith or Allison, you want to add to that?
Well, I quit my job just because what I was making was equal to what I would have been spending to have people come and care for him. So it just didn't make sense. I was, I think, 73 when I retired. I was going to work till I was 80. Librarianship is a pretty easy job, and I loved it, and I would have worked longer. But it was just financially, it was better to just quit and stay home with him.
Absolutely. Thank you. And then Dr. Appelbaum?
Well, there's no right answer to this, right? I think when I look back on my caregiving journey, I have very few regrets, but one of them is that I wish I had taken more time off from work when he was feeling well to enjoy time with him when he was feeling well. I was in the space of wanting to protect the vacation or 6 days I had for the crises and the emergencies and the hospital runs and what I knew would be his eventual decline and death. I wish I had taken time off when he was well. And so I think that if you're in the position of wondering around about the value of work, and you might be in the position financially where it would be okay not to work, I would strongly encourage you to really consider that. Because ultimately what matters most at the end of the day is the time we have with those we love, not the time we spend in our offices.
Yeah.
Well said.
Well said.
We'll let that be the last word. Excellent, you guys. Thank you all so much for this. It was such an incredible discussion. I wish we could do this all afternoon, but I know we all have lives to get on with. So on behalf of the Lewy Body Dementia Association, I'd like to thank you all for taking time out of your day to join us. I'd like to thank Dr. Allison Appelbaum, Judith Kowaleski, and Craig Denham for sharing your knowledge and your experiences with us. It was so rich, and you probably noticed all the emojis floating up there. In addition to the post-webinar survey that we'll launch after the session ends, Rose is also going to drop a link into the chat for a year-end survey to fill out at your convenience. There's just 13 quick questions about our educational programming for the year. It would be a great help as we're planning for 2025. And as a reminder, you're going to get that email in about a week with the link for the recording from today's session, hopefully that you can hear in full. We apologize for all the sound issues in the beginning, and also the resources and links that we mentioned in the webinar today. Please join us in 1 week on Thursday, November 21st at 12 p.m. for our penultimate 2024 webinar, Understanding the Overlap, the differences and similarities of Lewy body dementia and Alzheimer's disease. This webinar is presented in partnership with our research division and will feature Pam McLean, PhD. She's a professor and consultant with the Department of Neuroscience at the Mayo Clinic in Jacksonville, Florida. So please take a moment to complete the survey about today's webinar and next year's content, and we hope to see you all next week. Thank you again, everyone, for joining us. Have a great day.